This program is intended to be general in nature and should not be used as a substitute for advice from a qualified health provider.
On Health Matters Television for Life, they served our country.
I retired as E6 in 1980.
I retired as an E7.
But how is healthcare serving them?
This is our 41-foot mobile vet center.
See how this resource center on wheels is reaching vets in Washington, Idaho, and Oregon. Plus, understanding the unique needs military men and women have when it comes to their health and care. Right now on Health Matters.
Health Matters is made possible by our viewers, the Friends of KSPS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
I'm Arnie Peterson, and I'm an orthopedic surgeon, and I work at Sacred Heart for Providence Medical Group. When I needed my hip replaced, I chose Providence because of the professionalism and the care that I knew I'd receive. I never thought twice about going anywhere else.
Good evening, I'm Teresa Lukens, and welcome to Health Matters. Our focus in the next hour is on veterans' health. America's vets face some unique health challenges. They may have been exposed to chemicals, suffer hearing loss, battle depression, or suffer from PTSD. Tonight, we hope to bring new understanding to their medical needs. We also want to take a look at some of the resources that are available. And here to share their insight and expertise, our panel. Dr. Kim Morris is the Chief of Geriatrics, Rehabilitation, and Extended Care at Mann-Grandstaff VA Medical Center in Spokane. Dr. Quinn Bastian is the Chief of Behavioral Health Services at the VA. He is also a U.S. Navy veteran. David Baird is the Director of the Spokane Vet Center. He is also a U.S. Navy veteran. And Kevin Ginter is the Veterans Choice Program Champion for the Mann-Grandstaff VA Medical Center. His work centers on recruiting doctors in private practices to treat veterans. He is also a U.S. Navy veteran. And this evening, we welcome your phone calls, invite you to join the conversation. We'll also take your emails and texts. But first, according to the Department of Veterans Affairs, 9 million Americans served on active duty in the U.S. Armed Forces during the Vietnam War. Approximately 7 million are living today. It's been 50 years since their service, and now, decades later, they're hearing words many have never heard before. Welcome home.
Like so many military ceremonies, this one begins with the color guard and the presentation of the American flag. But this ceremony is different. The veterans being honored here at the Spokane Vet Center all served in the Vietnam War. John Peter Annell Jr. in the Air Force.
We were known as the Wild Weasels.
Richard Lee Hemming, the Navy.
I was on the USS Pine Island, a seaplane tender.
They've come to support their fellow vets as they receive the Vietnam Veteran Lapel Pin.
Our country, our community, our families, and our children owe you a debt of gratitude.
The pin is designed as a lasting memento of the nation's thanks. Thanks that is decades overdue.
They're especially important for Vietnam vets because we didn't receive any recognition when we came home from Vietnam.
In fact, most hid their service.
We hid so well, we hid from one another. In some cases, I could even say we hid from ourselves. We finally can ask for help. We can finally begin connecting with other people.
Both men agree the welcome home is different for today's military. It's changed for Vietnam veterans too, like this recent breakfast of combat vet riders.
There was 8 of us there, and when we got ready to pay our bill, there was a lady that had stopped by to thank us earlier for our service. She gave the waitress $50 toward our bill.
It happens a lot, says Richard. Mostly, it's being thanked for his service.
Sometimes it's hard to answer to thank you because it's humbling.
And while a thank you is appreciated, it's being greeted with a welcome home that means so much.
Because we didn't get it when we came home.
The reason it's important is because why I say welcome home. We never came home. We were barred from our own country.
So at ceremonies like this one in Spokane and across the country, America's Vietnam veterans are being given a proper welcome home, a long overdue acknowledgement for Richard.
I was American by birth, patriot by choice.
And John.
What was it like? Well, I can't explain it. I just know it had to be done.
And millions like them.
A lot of people like to call us heroes, but I don't look at it that way. We're just doing our job.
A job our nation is finally embracing.
And Dave, you were there for that ceremony. We saw you in that piece. An emotional day.
Yes, ma'am. It was very emotional. You know, even just watching that clip right there brings it back. That the one fellow that was talking, his road name is Precious. He's in the Combat Vet Riders, and he really did speak to it in terms of the homecoming that really they did not get, that they deserved. And even though here we are 50 years later, we now have an opportunity to do this. And what's so amazing to me is even with the homecoming that they got, they're so humble and so gracious and so, emotional and open and receiving of this token of our welcome home. And so, yeah, it's such a, I just want to say it's such a privilege at the Spokane Vet Center to be able to do these pinning ceremonies. And we're going to do them until we've pinned every Vietnam veteran that comes forward. We have gotten just almost truckloads of those lapel pins welcoming them home. So we welcome any Vietnam veteran. We'd love to pin that on you and welcome you home.
Mm-hmm. Is this a tough group to bring out? Are they, because they don't even recognize it because of the way they were treated, or because it's been so long, or they've stayed behind the scenes? What is it?
It's a great question, and it's a complicated answer, I would say. I know part of it is just based on the sentiment of the culture at the time. If I could just, this is such an oversimplification, but to mistake the war with the soldier, and then to put the discontent of the population onto the soldier, caused so many of these men and women, when they got home, immediately to just go underground with whatever it was that they were facing, grow their hair long, and just try the best they could to disappear into the shadows. And here we are 50 years later, and that's still very true. One of the things that I have the great privilege of doing is organizing all the veteran entries in the Lilac Parade, in the Armed Forces Parade. And I am telling you, these Vietnam veterans that go through that parade are literally surprised. I mean, not just thankful, but surprised at when they go by, the crowd stands up and salutes and claps, and they're just blown away. So it's just amazing the way these old feelings of, wow, I'm going to be rejected again, and that does keep them from coming out of the shadows. It does keep them kind of isolated.
Mm-hmm. And Dr. Bastian, they do have a unique set of needs emotionally, don't they?
Well, they do. We find that veterans from different eras do have different sets of needs, and especially with our Vietnam era veterans, part of that is the willingness and the openness to come in and embrace the VA and see what it has to offer, or the vet center, and are sometimes surprised, as Dave says, about the reaction. To complicate that, now they're getting older, right? Many of them are retired. That means more time sitting at home thinking about stuff. And needing to find other ways to occupy themselves, because sitting at home thinking about stuff is not very pleasant to somebody who's got a trauma they've been suppressing for years.
50 years. For 50 years. Yeah, many years. What are some of the discussions you have with veterans and their needs emotionally and mentally, and that isolation that they may be feeling?
Well, there's a lot that we talk about, and it really varies depending on who the veteran is. Mm-hmm. Sometimes they want to talk about what's going on with their family. Many times what they don't want to talk about is the trauma, is the issue related to PTSD, if that's what they're experiencing. A classic sign of PTSD is avoidance, is not wanting to go there, not wanting to think about triggers, reminders, or the experience itself. And yet it turns out that it's very therapeutic to do that in a constructive way. It's a core element of treatment for PTSD, is finding a healthy way to go through and experience that trauma in a way that is corrective, in a way that helps process it a new way, so there's a new understanding and a new resolution.
Is that a constant process?
It's not constant, but it's ongoing. So recently my daughter was in a car accident here in Spokane. She broke her wrist. After a couple of casts, she got it out and needed to do some physical therapy. And so what happened is the physical therapist sat down and said, okay, this is going to hurt. It's going to be painful. You're not going to like it. But it's really important to do this if you're going to get your mobility back and the functioning in your wrist. Now, she's done the exercises. It hasn't been comfortable for her. The hope is that she will have full mobility, but she may always have a little bit of a twinge there. She may have a little bit less range of motion. Therapy for PTSD is a lot like that. It's painful. It hurts. It's not comfortable. But it works, and it helps restore some of it helps provide some relief. It helps restore some of the functioning, some of the mobility that, that our veterans have.
Mm-hmm. Group therapy helps?
Group therapy helps as well. They're very effective therapies, both individual and group therapies. There are some real advantages to group therapies because veterans also have other veterans with whom to connect and bond and share experiences and learn from.
Mm-hmm. And they also have a lot of medical needs. They're aging.
Yes.
We talk a lot about World War II veterans, but the Vietnam veterans are getting up in years as well. And
Absolutely.
They have some unique medical conditions.
Yeah, and then the nice thing about the Spokane VA is that the leadership identified that, and a couple years ago put the resources forward to develop a geriatric department to really focus on the needs of that population.
Mm-hmm. Talk about some of those needs.
So as particularly the Vietnam era veteran ages, and as we see the World War II veterans departing, they have particular needs, and a lot of it comes at the end of life. And so what we provide is palliative care and hospice at the time that they need it. We have a community living center, which is attached to the hospital that has about 32, we're growing to 38 beds, that can accommodate veterans who need a short stay rehabilitation if they've had some sort of injury. Also, if they just need a transitional space to be, they can be with other veterans, and that's a very supportive environment. And so we provide rehab there, we provide wound care, a lot of different services if they need in-house services. We also have, and a lot of veterans may not know this, we also have services in the home that we can provide if they're eligible. We have homemaker home health aid and community adult day health care. So if they're needing, services while they're home to help them cope better with different illnesses that they may get as they age, we can provide those services as well.
Mm-hmm. Are you seeing some unique illnesses to the Vietnam vets?
Vietnam veterans usually have several comorbidities, so many different medical problems that create a complex situation for the veteran. On top of that is mental illness as well, and a lot of substance abuse is what we see. So it's a very multidisciplinary approach that is needed for their care. And so the nice thing about the VA is we have social workers, and we have geriatrics works as a very interdisciplinary process. And so we can provide those services for the vet as needed.
Mm-hmm. Kevin, we want to get you in on the conversation here. You reach out to veterans and providers across the entire Inland Northwest with the Choice Program. Talk about what that is and how it works.
I do. My role as the Choice Champion, I act as a liaison for our facility, for the VA, also for the veterans. I also act as a liaison to the providers that are seeing vets. If you will, I just administratively make sure that the program is running well for them. I do not create or write authorizations, but once they're established, I just make sure that everything's running smooth. And if we need an assistance or if I need to reach out, that's what I do to make sure it happens. The Choice Program is the program that we're utilizing if we cannot treat veterans at the VA hospital. Then the Choice Program allows us to treat veterans out into the community with community providers. There's 3 different ways that veterans could qualify for the Choice Program, knowing that we always want to treat veterans at the VA. If we don't have that service, we can treat them, we can get them an authorization out in the community. If we can treat them at the VA, but we can't do it in a timely manner, which, if we can't get them in within 30 days, then we may be able to get them a provider out in the community. And that's the liaisoning work that I do with our Care in the Community office, with our team, with our third-party administrator in Tri-West, and the local administrators.
So they still get their benefits, but they're working with a separate provider. That's basically how it works?
Correct. If they have a choice provider, that actually is, for means of their eligibility, it counts as a VA provider. We will get the authorization for them to go out in the community. That documentation comes back to the VA. All of their treatment records would come back to the VA so that we can consolidate those.
Mm-hmm.
Can I share?
Absolutely.
So I think our interim director of our hospital, Ms. Tracy Davis, said it really well recently at our Veterans Mental Health Summit. She had come to sign the Secretary's Suicide Prevention Declaration at our summit. This is a declaration of what we're going to do as an agency to improve our suicide prevention efforts and reduce suicides among veterans. And as she came to the stage to sign it, she shared a few words and she said this. She said, if we're going to meet the Secretary's goal of getting to zero, we need your help. She said, no healthcare agency can do this alone. We need to collaborate. We need to work together with veterans. We need to work together with community partners and agencies so that we can together reach this goal. And I think now is a really exciting time to be part of the VA because I think never before have we had so much importance and so much opportunity to collaborate with those in the community, such as through the choice program that Kevin's talking about.
Well, and in fact, this suicide piece is going to be a very broad campaign, isn't it?
Very much so. It is. It's one of the Secretary's top 5 priorities. He's rolled out a number of new initiatives that we'll be engaging in here in Spokane and elsewhere across the country to really help support our veterans who are at risk for suicide and to bring that number down to zero.
And in fact, part of that piece will be a TV campaign, and we have a very short public service announcement that we want to show people that will be part of that initiative.
I'm good.
I'm good, but I have a story and I don't know where to start.
I still have nightmares.
I feel overwhelmed.
I can't live like this anymore.
I'm really not so good, but are you ready to listen?
Very basic, but talk about the meaning behind that campaign.
Well, it is. It's pretty basic. It's very straightforward, but it carries a very powerful message that in order to support those around us, we have to be willing to listen. One of the real challenges faced by both our veterans and our active duty service members in getting help for their concerns is the stigma that goes along with that, is the shame that they perceive. In the military, you're taught to be strong, to get through the struggles. You hear phrases like pain is weakness leaving your body. That's a famous one from boot camp, right? So people are told to embrace the pain rather than to acknowledge it and recognize their limitations. So it's very hard many times for a veteran or an active duty service member to come forward and say, I'm not really doing so well. And they need an assurance that somebody is actually willing to be there and listen. One of our goals in the VA is for every member of our VA staff to be well prepared to help and intervene and save a life. For everybody to be a first responder. Our hope is that our community will team up with us and that everybody will also embrace that goal for every member of our community, all our community partners, the mental health providers out in town, our veterans themselves as buddies, as battle buddies for other veterans, to be willing to intervene to help save a life.
And Dave, you see that on a daily basis, that transition, that trying to get back into civilian life.
Yes, ma'am. As a matter of fact, the umbrella agency over the vet centers, there's 300 vet centers, is called Readjustment Counseling Service. And that term readjustment is exactly that, trying to help our veterans integrate back into community. And very much, one of the pieces about suicide that is pretty, when you look at maybe what happened or what are some of the risk factors, pretty consistently across the board is the veteran is not in some sort of a support structure, is not in some sort of a community. I have to be honest with you that when I first started noticing that trend, it really shifted kind of the way that we do business at the Spokane Vet Center. When I first got there, it was very much individual appointments, one after the other, with a few smatterings of group. We've become much more group-centric and kind of what I would call a wellness community. Where we try to do a lot of things where we get our entire community of veterans that we serve together at the same time, doing barbecues, we do a great big Thanksgiving feast, but just coming together as a community, these pinning ceremonies that we were just talking about. My belief is that one of the most important, what we call a protective factor in preventing suicide is to be in community and to create community. And then there's a second piece, and this is a transition that we're currently making, is once we're in community to then kind of turn around and reach out and pull more people in. we're really solid now. Now it's kind of like, bring a friend. Let's keep increasing that. So.
We have our first phone call tonight from Ray coming from Republic. Hi, Ray.
Hi.
You have a question?
Well, kind of a comment and a question. I'm a CB veteran from the Korean War, and it seems to me like we jumped from World War II into the Vietnam War, and we just kind of don't mention. But I would like to say this, that I think that veterans should have definitely a job or training for a job before they're discharged. We're kind of sometimes anxious to leave the service and get on with the rest of our life, and so we agree to things that maybe we shouldn't agree to. I think there should be jobs or training definitely for the veteran before the veteran is discharged and off the payroll. How's that?
Ray, thank you very much, and thank you for your service. And we are putting some of those programs in place.
Yes, ma'am. At the Vet Center, we actually have someone that comes from WorkSource. Will come and actually occupy some office space for a couple days a week. And Ray, while I can't, jump into the active side of the house and make that training happen, we are really on it in terms of when the veteran has crossed the brow for the last time, that we try to bring as many agencies forward as possible. I want to say one word about the Spokane community in particular, and Ray, I know you're up in Republic, but what a great community in terms of being proactive in hiring veterans. You know, these men and women so many of them are battle tested and have that discipline. So I guess I would say to the employers that are watching this program, hire vets, that's what you want. They're going to be loyal. When you reach out to them, man, they'll reach back. So, but back to it, we have WorkSource there, and these are folks that specialize in taking military service. Ray, I'm a CB too, so good to hear from you. And I really appreciate your point about how the Korean veteran tends to be overlooked sometimes. We call them the silent generation. But anyway, yeah. We're really trying to make those programs happen. These guys are specialists in taking somebody's MOS, their job code in the military, converting them, recognizing what are the civilian skills, and then trying to match them up with folks out in town.
Well, and in fact, a lot of the colleges now are recognizing the training that they received in the military.
And giving them college credit for that.
And giving them credit for it. Because until recently, they were being retrained for jobs they already knew well.
Absolutely.
It was a crazy system. So now at least that piece is in place.
It's actually a part of my story. I got halfway through a bachelor's degree through my Navy training. That I literally got that much college credit. So I was absolutely blown away by that. And that's, a lot of times when veterans get out of the service, they're looking for a new mission. And what better mission than education? And so any roads that we can make to help the veteran get on campus, stay on campus, we need to take those roads.
Mm-hmm. Well, and just having a purpose, a reason to get up in the morning. As you mentioned, they've had sort of this stringency, there was something to do at every minute of the day when they were in the military, and they get home and suddenly they're in flux.
Sure, absolutely. One thing that I'm really pleased to see in the VA now is a shift to thinking more about the whole experience, the whole life, the whole veteran, rather than just medical needs, rather than just treatment. We've kind of, as a healthcare agency, we focus mostly on treatment, whether it's outpatient treatment, residential treatment, inpatient treatment. Now we're taking a broader focus to look at that full spectrum of the veteran's experience. What about life outside of treatment? What about all those other activities that give meaning to life, that give purpose to life, that may not have anything to do with treatment or care or coming in to see a doctor for an appointment, but that really add meaning to a veteran's life and help them get from one day to the next with a real sense of accomplishment and value and purpose.
Mm-hmm. And that's where that team approach comes in.
Absolutely. And, meaningful activity. We always talk about that in geriatrics, and it's so important to quality of life, and really focusing on that quality of life and the whole person and really treating that. And we actually have an integrative health section to our armamentarium of services at the VA that we're continuing to develop. So we are really taking a different focus as a VA medical center, particularly here in Spokane, to address all those different facets of the veteran's life.
Mm-hmm. And Kevin, as you reach out to providers to bring them into the choice program, I would guess mainly in rural areas, is that the case?
Well, both in rural areas as well as in downtown Spokane, Coeur d'Alene. Our region is very large. Most of it is rural. But like Dave said, we're very blessed in this community. This community loves their veterans, and they are more than willing to learn about how to come on board and help treat the veterans, and how to partner with the VA to get these veterans the care that they need.
Mm-hmm. So those conversations with doctors and providers, are there a specific set of questions that need to be answered before a doctor can really jump in and work with a vet, or just a caring doctor needs to be on board?
Anybody that wants to assist and get a partnership with the VA, we're more than willing to have that conversation. The big thing is, how do they get their authorization? How do they know the veteran? How do they get their medical records? Those are all questions that we can answer. Those are all the questions that I'm more than willing to have conversations with. So if you have a question, by all means, let us know. I will reach out. We do community reach outs. We do town halls. I've went to many providers' offices and discussed, sat them down on the computer and talked to them about their roles and responsibilities, and just walk them through and know that we're there for them as well. Like I said, as a liaison to the VA and to the provider, that's what we do. I work with not only with our care in the community office, but I also work with our third-party contractor, which is TriWest, to make sure that the veterans are getting what they need, to make sure that the authorizations are working. So if there's ever any question, we have teams that are standing by to answer those questions.
All right.
I think, to speak to your question a little bit too, what questions would you need to ask a community provider to make sure that they're ready to work with veterans? There are many services that we offer at the hospital that would be the same for a veteran as for anybody else. It's likely that a knee surgery is going to be pretty much the same for a veteran as for a civilian. There are other things that are specific and unique to veterans, and mental health, a lot of that falls in, to that category. And so the VA has a lot of resources, online resources, free training for providers. We were really thrilled at our recent mental health summit to offer CEU credit for any mental health provider in the community who wanted to come and learn more about working with veterans. We had a specific class about orientation to military culture. There's a lot of training about working with PTSD. Our suicide prevention coordinator has a requirement that every month they're out in the community sharing suicide prevention tips with our community providers. So we really do try to reach out to the community and help in that way to make sure everybody's prepared to see a veteran when they walk in the door.
Excellent. We have Walter from Cheney. Good evening, Walter.
Good evening. How are you?
Very well, thank you.
I'm a World War II veteran, but I have a question regarding suicide. It appears to me that anyone who says I'm suicidal or asking for assistance or help. My question has to do with those who deal with the suicide. How do you predict a person is suicidal if he doesn't so indicate that he's suicidal?
Very good question. Those signs.
Yeah, it's a wonderful question, Walter. The reality is that not everybody has those overt signs. You don't always see it. There are some signs that are very concerning, particularly when you see somebody who's talking about suicide, or somebody who's making a plan that they share about ending their life, or particularly if they're collecting the means by which to end their life. Those are kind of the big three flaming signs that somebody's at high risk. There are other signs, anger and hopelessness, that are there, that sense of being alienated and alone, like Dave talked about a minute ago, mood swings, changes in substance use, things like that are warning signs, but they're not always there. The recent research that the VA has conducted in coordination with the RAND organization shows that about 24% of the people who attempt suicide, that impulse only lasts 5 minutes. That's not somebody who's thought it through. That's not somebody who's made a plan or talked to a friend about it or shared any signs necessarily. It's an impulsive act, and if that can be delayed, if there's somebody there to help and delay that even for just a few minutes, sometimes that can make all the difference. But it is a very challenging issue, and you're absolutely right that it is a concern for all of us that we don't always have those signs. One new initiative the VA has got to try to help specifically with that issue is working with partners in big data. a new initiative that looks proactively at all the data that we have about a veteran's health care, for example, to see if there may be somebody at risk who's not talking about it. They may not even be engaged with the VA. So we can prospectively, we can reach out to that veteran and ask if there's some help that they need, some help that we can offer. So I think it's an exciting initiative to be able to reach out that way, just looking at the pattern of attending appointments and the medications they might be using and changes in other things. But unfortunately, we don't always see the signs ahead of time.
We have another phone call. Al from Spokane. Hi, Al.
Hi, good evening, and thank you for taking my call. I have a couple of comments. The first comment is a choice program. It's, for the veteran, it's a joke. First you wait until you hear from the VA, yes, you can go see this doctor. That takes up to 30 days. Then you go in and see the doctor, and in my case, the doctor said, you know, you really need a brace on that arm. And I said, hey, good. He left the room, came back, and his office manager was with him and says, oh, he needs a brace, but he has to pay for it because the VA, in order for them to pay for it, we have to send in the paperwork to the VA. It could take up to 30 days before you find out if the brace is going to be paid for. Well, come to find out, the office manager was exactly right. Other veterans who've worked with the choice program, it's a joke. It sounds good on TV from your people that you have in, but in reality, it doesn't work. The other comment is when you have confidence in your medical facility and you go out to this facility, and here for over a year, they haven't been able to get the front door done. And the VA should get out of the construction business, get in to the medical business. And I thank you for taking my call.
Thank you very much, Al. Kevin, can you address some of his concerns?
Thank you, Al, for calling in, and thank you for your service. When the choice program is a little over 3 years old, and when it first kicked off, we did have some hiccups. We have worked very diligently both with the community providers and with the personnel in our staff, whether it be at our prosthetics department, like he mentioned, or with our pharmacy for medication. If you run into an issue, please, we ask that you contact us. We have the ability and we have the staff to work through the issues. We just ask that you don't suffer in silence. If we don't know about the problem, then we cannot fix it. We do have a staff in our care in the community office that is standing by to assist for issues like that. For the brace, as an example, yes, the brace would have to be filled at the VA, but if we know about it ahead of time, or if that provider can pre-plan that, then we would be able to get that ready for them for that, whatever that procedure is.
What's the best route for Al to take then? To make that phone call?
Please contact us at the VA, and we will make sure that the right person is helping you.
Okay. I want to talk a little about female veterans, about women. They have some unique needs and challenges as well, and there's an aging population there. What are some of their health concerns?
Well, fortunately, we do have a women's vet section to our VA services, so that's fortunate. And women definitely have, distinct needs, and fortunately, we're able to accommodate them, particularly in our CLC, if they need rehab needs or have concerns, have a need to have a short stay with us. So we definitely can accommodate them. Some of their unique needs, some of it overlaps with the male gender as well. So we see a lot of cancer in the aging population. We see a lot of neurologic issues, a lot of autoimmune processes, just the multitude of different medical ailments, and women are affected just as much.
Are they more willing to seek care sometimes than men?
I think with a predominantly male-dominated VA, it's hard to, really ferret that out. But they come forward. I'm sure there are some that are more hesitant, but we see a fair number of women veterans in our medical center.
What about the mental health side for women?
Yeah, I do think that we see, at least locally, we do see more women than men, or a higher proportion perhaps, coming to seek out care. We know that about 9% of the veterans that come to us for mental health about 9% of the veterans that come to our facility are women. About 12% of our mental health patients are females. So we have a little bit higher proportion than that. It's projected that within the next couple of years that 50% of our female veterans will be between the ages of 45 and 64, as you say, and about another 13% over 65 or older. And so they are an aging group. Dr. Morris suggested that there are some things that are different for female vets, and I think she's spot on about that. Two things that we need to be able to do and do well. One is to create an environment that is welcoming to our female veterans. And sometimes that's as simple as paying attention to the pictures we have on the wall, whether we have pictures of women veterans as well as our male veterans. Sometimes it's changing the layout of an exam room so it's more accommodating for women, or providing on our inpatient psychiatric unit, for example, rooms where women can lock their doors if they feel uncomfortable. Staff can still get in case of an emergency, but when they go to bed at night, they can lock their door and feel that safety and security. The other thing we need to do is make sure that we're really doing a great job at treating conditions that are unique or more common among our women veterans. Just to give you one example of that, both men and women in the military do experience military sexual trauma. But it is more common among women veterans and among men veterans, especially the ones that come forward and report and ask for help. So the VA needs to be great at providing trauma care that is specific and sensitive to the needs of our women veterans, including military sexual trauma.
Does that include having more female providers? Do you have enough?
Well, I can speak for the mental health side. We actually have more women providers than we do male providers within our behavioral health service. I don't know about on the medical side.
Yeah, we have a fair amount of women, and particularly in our women's health area, we have ARNPs, so nurse practitioner, women nurse practitioners, as well as physicians. And also in our community living center, we have a fair number, probably half and half, female to male providers.
Do you see a lot of women at the vet center?
Yes, ma'am, we do. We're right at 12%. That's the same stat that we've got at the vet center. We have a women's group, an ongoing women veterans group. It's a support group that meets every other week. One of the challenges that we're finding is childcare. Childcare is, we have so many women veterans that will come in maybe when things have gotten to a point of criticality in their life where they'll engage treatment, but then will really fall off after things kind of stabilize a little bit. And when we're able to talk to them on the phone, hey, we miss seeing you in group, it's almost always about child care and the challenges of getting that child care to come into treatment. One of the common sentiments that is spoken about in our women's group is just kind of coming back and not being connected to the rest of their fellow veterans, more so than the men, I would say. And I really do believe a lot of that has to do with just that internal compulsion to take care of the family, to take care of the kids, but it kind of pulls them out of that community that we were talking about earlier.
We have Robert with a question. Hi, Robert.
Hello.
You have a question?
I'm a Vietnam veteran. Yeah, I'm a Vietnam veteran. I almost forgot the question. Once one is on the choice program, are they always on it, or do they have to reapply for each different issue?
Very good question. And Robert, thank you, and thank you for your service.
Thank you, Robert. For every episode of care that we partner with the community to get the veteran treatment out in the community through the choice program, that will have an individual authorization. Each authorization will have a certain number of visits and a certain episode of care time. They call it validity dates. Once that's expired, then we'll need to get you a new authorization if we need to get you back out in the community or before it's expired, we can look to extend it if the community provider believes that's necessary.
So at some point, it most likely will have to be renewed.
Absolutely.
Okay. We have an email we want to address. It's from Mary Beth and Cheney. She says, serving in the Air Force, my husband is frequently exposed to jet fuel. I've read this can cause long-term neurological problems and even cause hearing loss. How concerned should we be about this? And that's on the medical side, Dr. Morris.
So obviously there are neurotoxins in the environment, and jet fuel probably ranks within those toxins. So really it's a matter of the more exposure, the more at risk you are for developing a neurologic problem. And so really trying to lower your exposure burden is really the best advice that I could give. But there are many known neurotoxins in the environment, and that's a challenge that we all face. And particularly those who work with those toxins on a regular basis are more at risk.
Mm-hmm. If I can jump in on that one, one of the things that's really coming forward from our Iraqi veterans is the burn pits. There's these areas in Iraq where there's just no, what would you say? There's no filtering or screening exactly what gets thrown into these burn pits to be destroyed. So you'll have all kinds of petroleum products, batteries, things like that. And we are finding an uptick in cancers and also some neurological issues. I don't want to speak to the medical side too much, but I can tell you that the studies are out there that show those who are exposed to burn pit are some of the other areas that are at risk.
We have a question coming in from Jerry in Moscow. Hi, Jerry.
Yes, I'm here.
Yes, sir. Do you have a question?
Yes, I do. I'm irritated with the payment thing on my veteran when I go to get medicines or anything else like that.
Yes, Jerry?
Yes, I'm watching me on television.
Did you want to finish up with your question?
Yes, the problem that I have is these co-pays. I had 29 years in the military, and every time I go to get something, I got to pay a co-pay. And I think that's a bunch of baloney. And I don't like it. Is there a way to get around it?
Jerry, are you on the choice program?
Yes, I am now.
Okay.
I can actually address that. Jerry, our eligibility department would be able to take your information. I would request that you would reach out to our VA and we'll get you hooked up with the eligibility department. They have a screening form that they can utilize to see and make sure that they have your most up-to-date data, and we can reinvestigate that copay.
Is it typical to have a copay?
Some veterans have copays depending on their enrollment status and their enrollment group, and depending on if they have a copay with the VA, they will also have a copay with the choice program. So no cash should change hands between you and that civilian provider. If you have a copay, then our billers will come back or will come and talk to you about that afterwards. But you don't have to worry about cash in your hand exchanging between you and a choice provider. But if you have a question about your copay, please contact our eligibility department. They would be the ones that would be able to give you the best answer on that.
All right, and of course getting face-to-face with someone is one of the best routes to take. There are lots of resources available to veterans online or over the phone, but nothing beats meeting someone in person with that friendly face across the table. And that's the idea behind the Spokane Mobile Vet Center. It travels all over the area, reaching servicemen and women in some of the smallest communities.
Robert Stewstardevant travels a lot of miles as the operator of the Spokane Mobile Vet Center.
Over 225 stops a year.
The Vet Center on Wheels covers 35 counties in Washington, Idaho, Montana, and Oregon.
Our mission is to go out to rural areas and try to find the veterans who are isolate, who need assistance.
For Stu, it's pretty simple.
I sit them down and ask them basically, how can I help them?
The mobile unit travels mostly to rural communities where internet service can be limited. visiting vets who might have a hard time getting to an office in a large city. No appointment needed.
Well, that's the great thing. You just show up.
Stu connects veterans with military benefits, as well as services from counseling to medical assistance, even food and shelter.
And they might be amazed at some of the resources out there that they can use, they're just not aware of it.
The mobile unit is self-contained, often running off a generator. Stu can make calls, go online, even fax. But it's not technology that brings vets in, it's the warm welcome.
No matter what the issue is, I'll get an answer for them.
For Stu, a retired veteran himself, it all comes down to one thing.
What makes me feel good is helping others, giving back. And to see a vet have everything they need that they can go on, that makes me feel good.
And Dave, it sounds like Stu has to wear a lot of hats in the mobile vet center.
Stu is amazing. He's my guy, man. I'll tell you what. Stu is one of those guys. He meant what he said, and there he puts the action behind the words in that if he doesn't have the answer, he'll find the answer. We love our mobile vet center. It's something that we've had for about the last, I believe, 7 years, if I'm not mistaken, and we've had a number of different models. We really like the 41-footer that we've got right now. One of the things that was in that, the clip that you just showed, is there was this a TV screen with a camera right underneath it. It's what we call the telehealth suite. One of my favorite aspects of our mobile unit is we can go up to a small community, let's say Tenasket or Republic or up in Newport, and I can have one of my readjustment counselors at the vet center at our telehealth suite literally doing readjustment counseling with a veteran that maybe doesn't have the means to come down to our center. What's so great about that particular rig is it's got different sections, so we can have that going on in the back of the rig, while Stu is up front helping sign up a veteran for the VA. We have a state-of-the-art communications suite that we can be anywhere on the generator and speak to any VA database, or server from anywhere. It's also a national asset that if we have a local disaster that happens, mobile vet centers, we're at Katrina, we have mobile vet centers that have been down with Harvey, and with these other hurricanes, we're right there, and we're ready to be utilized. We've got spots for gurneys. I know one of the things that we do with our local mobile vet center is we'll go to these homeless veteran stand downs, and it's one of the ways that we partner with the VA is they'll have free dental exams in that mobile unit. Recently, we were able to also help out with the homeless program downtown and provide some much needed office space when they were in a little bit of an office space crisis down there. So it's just it's become such a multi-use vehicle that we're great. We couldn't have a better person at the helm than Stu.
And it's on the road all the time?
All the time. We are on the road probably 4 out of 5 days, a lot of times on the weekends. So Stu works a little bit too hard. So
yeah, he seems pretty amazing.
Oh, he's a great guy. Yeah. Absolutely.
Let's take another phone call from John in Liberty Lake. John, thank you for waiting.
You're quite welcome.
And you have a question?
Well, yes, I've been in the VA healthcare system at Mann-Grandstaff for about 15 years, and I'd simply like to pass on some kudos to the hospital and all of the staff. In those 15 years, I've never had an unpleasant experience from any of the employees out there. Indeed, I found them all to be extremely helpful, very courteous, and they provide excellent levels of service, care. They're overworked and avalanched with the number of vets they have to serve, but somehow they seem to get the job done. And I've been hospitalized at the VA center or VA hospital there twice, and quite frankly, I hate to say this, but the level of care there is so far superior in the hospital setting to any other of 2 other major hospitals I've had here in Spokane. I've been in Spokane, that it's my first choice. And so I just simply wanted to pass on a few kudos, given the fact that Congress has always seems to be jumping on the VA. And but my experience has been outstanding. And quite frankly, I've talked to a number of my combat vet friends, and their experiences almost to the person and almost identical.
Well, thank you. Thank you very much for your call, John. I think our panel appreciates that. You don't always hear that, do you?
No, you don't. You don't always hear it, and I think it's understandable because, like any other healthcare organization, we have our share of challenges. The thing that strikes me, and I really appreciate your call, John, and thank you for saying thank you, is when I pull up in the morning to start my day, and I see hundreds of other cars, and I see we have about 1,000 people that work for our VA hospital system here in Spokane and in other areas. I see those employees trickling in, and I haven't met one yet that wasn't there to do the best they could that day for the veteran that was going to be sitting across from them. Of our employees at the VA, we're almost half of us veterans ourselves, and very motivated to do our best job. So though we do have challenges that we face, and we do our best to tackle them, and you know, even though we give our best today, we're always trying to learn how to do even better tomorrow. It's great to hear that feedback. Mm-hmm. Thank you, John.
And room for expansion. There's some exciting things going on with the new medical center or the new medical school, I should say, here in Spokane, and partnerships going on, and so there's more to come.
There's a lot more to come. We're really, it's an exciting time to be part of the Spokane VA because we're really poised for a lot of growth. I think one of our challenges is figuring out now what we need to look like 10 years from now or 5 years from now, and how we're going to best meet the needs of our veterans moving forward as they change. I don't know, Dr. Morris, if you want to talk a little bit about the education piece.
Yeah, we're really excited about the WSU Medical School and, of course, the University of Washington Medical School with Gonzaga and the expansion there. And we've really ramped up our partnership efforts with those medical schools and with the residency programs. And there's been ongoing discussions with our congresspeople and the community partners about how do we thoughtfully grow medical training, and how can the VA best partner with those other community partners. So it's a very exciting time for our region, for the community, and VA is going to be a major part of that. Mm-hmm. So it's exciting.
Mm-hmm. It does take a unique personality, does it not, to work in the field that you work in?
Oh yeah, I would say yes, it does. And I echo what Dr. Bastian said. I work with an incredible group of people at the VA. It's the best job I've ever had. I love what I do at Spokane, and just the unique opportunity we have to develop the programs as we see best for the veteran, and that we have the support to do so. It's a very exciting place to be.
And making sure they're evolving and
in the appropriate direction.
To the need.
Yeah. And absolutely. Our leadership is very, very in tune with that, and listening to the voice of the veteran and us as service chiefs and employees as to what we see as the vision for the medical center as well. So it's a great time to be at the Spokane VA.
Mm-hmm. And Dave, do we have enough services for vets right now, in your opinion?
I think that we have services in the right areas. As Dr. Bastian was talking about, I think the word was avalanche. There is a lot of need. I don't know if you're aware, but the Inland Northwest, I believe, I read this stat just last week, we're second in the nation per capita for veterans. And just in the Inland Northwest, we have about 75,000. And so that's just, we have the programs in place. It's continuing to grow them. And so I also echo, I'm so appreciative that we currently have an administration and leadership that is very forward-thinking. What I'm really also appreciating is the partnership that's happening between the Vet Center and Mann-Grandstaff. It was just on a meeting last week talking about some more of the ways that we can really partner to ensure that we've just got this great wraparound service where we've got, all the way from the acute care that's needed when somebody is in sort of a medical crisis or a mental health crisis, all the way to more of what we offer at the Vet Center, that community, those ongoing groups, to just help veterans stay plugged in. I want to say one more quick piece if I can. One of the things that I love about the charter at the Vet Center is that we not only care for the vet, but we are able to care for the veterans' families. And that is so valuable to be able to not only provide that important readjustment counseling, that trauma counseling, But to not do that in a vacuum, but to bring in the spouses, bring in the significant others, to bring in the kids. We have an ongoing spouse support group that is just a joy. It's in the office right next to me, and Audra Stillians runs that. And I mean, just to hear those spouses laughing and enjoying each other and figuring out that they're not alone, and able to talk about what it's like to be a spouse with someone who's been in combat, and the unique challenges that offers as well. So that's another important service that's available.
Well, we are getting close to the end of our program, but I want to bring in some last thoughts from you, Kevin, before we sign off tonight.
I would just like to say, first of all, I'd like to thank everybody for their service. As Quinn said, the majority of the facility that we have, 50-50 are veterans. It's a way for me personally to continue to serve, and I would just like to thank you for your service. Welcome.
Well said. I want to thank all of you for being here tonight. It was an excellent discussion, and if you would like more information, and there was a lot of it tonight, we have posted some of those resources for veterans at ksps.org. Just click on the Health Matters button, and then you're going to find all kinds of helpful links and phone numbers posted there. Be sure to access that. And that's going to do it for this show. Thank you to our great panel for a wonderful discussion. Our thanks as well to everyone who called in or emailed questions. We will be back next month with another edition of Health Matters. Join us on October 19th when our topic will be sleep. Until then, I'm Teresa Lukens. Good night.
Health Matters is made possible by our viewers, the Friends of KSPS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
I'm Arnie Peterson, and I'm an orthopedic surgeon, and I work at Sacred Heart for Providence Medical Group. When I needed my hip replaced, I chose Providence because of the professionalism and the care that I knew I'd receive. I never thought twice about going anywhere else.